Do not be alarmed. It's just a couple of guys. Who are these guys? Ray Regina, beloved former mayor of St. Charles, lifetime educator, and Pat Crimmins, a Geneva lawyer, but he's actually okay. From Elgin to Aurora, from Naperville to Elburn, these guys are gonna talk everything. So, here's Pat and Ray.
Hello friends, welcome to Just a Couple of Guys. Pat Crimmins, here's truly Ray Regina, and I want to say out of the gate here that I'm so grateful that our crafty cinematographer set up a podcast with Geneva Eye Clinic. And the reason I say that is because I think there's not too many topics better than talking about great eyesight and making sure you preserve great eyesight. And today, we are very, very fortunate to have one of the veterans in here in the Geneva Eye Clinic, Dr. Anjali Hawkins, not only an MD, but a Ph.D., who's an educator besides being a practitioner. And we're going to talk about all things relative to eye treatment, the prevention of eye disease, etc., etc. And so we're going to go through all of that today. And Pat, again, I'm really biased on this topic, but I just think it's a very important one.
Oh yeah, and we're all part of an aging population, and eyesight and eye health are far more important than ever, I think. She's going to talk about, I think, all of the diseases, the diagnoses process, and the treatment process, and of course Geneva Eye Clinic and how long it's been here and of what it consists. And so I think it's a business that our viewers should know.
And I would also say that while I'm sure there's a portion of the clientele that goes into Geneva Eye Clinic that are younger, the pediatric practice they have in here, the fact of the matter is probably many more people over 40 walk through here than under 40.
That's right.
Because as you said, as we age, eyes become a tricky proposition.
I don't know if you've noticed, but I certainly have. Fox Valley area is an aging population. So you can tell that by the schools. The certain grades are low in students. The older people are downsizing, and younger people just aren't having kids like they used to. So it's an older population, and this enterprise serves that population and others.
We're very excited to have the opportunity to talk to Dr. Hawkins, and we'll be doing all of that and being very comprehensive in doing so after a word from one of our fine sponsors. You stay tuned. Well, we're back here at the Geneva Eye Clinic, and we're very pleased to have with us Dr. Anjali Hawkins.
Yes, thank you.
And,
thank you for having me.
I'm so happy to have this conversation today. I actually one time with my own eye doctor said this would be a great podcast to talk about something that's so important and so special to everyone, that's their eyesight. And to have a dialogue here now and to get into some of the issues associated with the treatment of eyes and eye diseases is very important, so we're really happy. So out of the gate, we want you to tell our audience a little about yourself, your background, how long you've been here, your education, etc., etc.
Oh, okay. Well, very good. I have been at Geneva Eye Clinic since June of 2001. I did my residency at Rush University Medical Center in Chicago, a one-year glaucoma fellowship 3 blocks away at University of Illinois. Before then, I was in Washington State for my undergrad. I have an undergraduate degree in chemical engineering.
University of Washington?
University of Washington.
Oh,
Then I moved to Chicagoland area for medical school in 1990. Went to a school called Chicago Medical School. At the time, it was called Rosalind Franklin Health Science. And I did a combined MD, PhD. It took about 6 years. And then went to residency at Rush, fellowship at U of I. And in the meantime, got married and so on, stayed in the area. Always had thought I would go back to Washington State, but here I am, and still all these years later, so.
Once you come to Chicago, you can't leave.
I guess so.
Right?
I guess so.
You still like the Emerald City, I would
Of
assume.
course, yes.
Now, just a quick, you have a PhD in biophysics. Right?
Biophysics.
So, how do you integrate your research background with daily clinical practice?
Yeah, I mean, I think that's an interesting question. I, started out as an engineering major. I think, my father was an engineer, and I kid that we were given two choices growing up. You could be an engineer or a doctor.
Right.
So, I did chemical engineering, and I had lots of summer jobs and a job lined up, in fact. And then I thought, I'm not exactly sure that this is for me. I happened to visit my uncle, who's an ophthalmologist, was an ophthalmologist in New Orleans. And he showed me the office and pictures and told me about the things you can see by looking at people's eyes. You can tell who has diabetes, who has hypertension, and I was kind of wowed by that, and then decided to look at medical school.
Plus the wardrobe.
Yes.
Yeah, white coats.
No pencil protectors.
Don't really have to think about it too much.
And so then I applied to medical school, and one of the places I got in, Chicago Medical School, called me back and said, we see that you have this engineering background, are you interested in research? You want to do MD, PhD? And I had never really thought about it, and my father encouraged me to go ahead and apply to that, and I got in, and part of the reasoning was that tuition was waived, so that helps.
Yeah.
So I didn't really keep in mind what I would do with a PhD. What those schools are trying to do are make research scientists, leaders. You end up in academic, maybe you're the chairman of a department. And so when I finished my education, I looked both at academic jobs and community jobs, and I found this wonderful hybrid position where I could be at Geneva Eye Clinic, and then one day a week I could actually go to the university.
Well, I was going to ask that question too. As a lifetime educator, you've got this position as associate professor of ophthalmology. So how do you balance teaching and the actual practice? Actually, thinking out loud here, you think that you can teach when you have an actual practice. You've got examples galore all the time at your fingertips.
So, I think that's a really cool part of what I do. And if you ask a lot of doctors, they would be very envious of my schedule because, yes, I help run a private practice. I see patients. I live in a community. But one day a week, I get to go to the university and hang out with medical students and residents and teach and learn, in all honesty, keep up with new things. One students are teaching me things they learned from a different ophthalmologist that I may never see because I'm only there on Fridays and so on. So it's definitely made me a better clinician. It's made me a better surgeon. And it's a little hard to manage because it's far away, but every day my commute's 10 minutes. I live in Geneva. And then one day a week my commute's an hour and 15 minutes. And, it's been okay. I've really enjoyed it.
You don't use biophysics in your practice. Is that fair?
That's fair, but the PhD is more than sort of the biophysics or the exact thesis. It's, how to set up a question, how to answer that, how to read studies, how to write papers. So no, I don't use biophysics, but I think I still use my...
So it's the
PhD.
academic work you utilize in your practice.
Yes.
Let's talk a little bit about your style. Apparently you've received some quality reviews from patients, and communication is one of the things that they've highlighted. What is your style as it relates to that?
Well, yeah, I'm happy to hear that. I think I'm very direct, so and I try to put things in layman's terms. And this is the disease you have. I try to make it clear it's treatable. You did the right thing. You came in time. We're going to help you. And I try to explain it. For example, glaucoma. What is glaucoma? Well, it's a disease of high pressure in the eye. It affects the optic nerve. Each eye only has one nerve. And high pressure can suffocate that nerve. People can lose peripheral vision, and it's a disease that can cause blindness. But that first visit, there's so much information. How do you treat it? What is it? What do I need to do? Sometimes I find they come back and then they say, well, wait, what is glaucoma? And then you say it again, and it can take more than one visit for people to understand the disease process.
And that obviously is different than cataracts, which
Right.
is sort of the floaters that people talk about. Is that right?
No, so different things. Cataract is an age-related change to the natural lens of the eye. That's like gray hair. Everybody gets it. It's the single most common surgery in this country. People will report halos, glare, blurred vision. Treatment is surgical. Floaters are something different. That's in the back part of the eye, the vitreous cavity that, things are moving around. But if you get sudden floaters and flashing light, it could mean that you have a retinal tear, and that's an emergency. But a lot of floaters are very normal. A lot of people have them.
I think it's an important question here. You mentioned glaucoma, and of course, I know several people who have glaucoma. My father had it, and so it was hereditary. And so, for me, it's an annual field test for me because of the heredity. So, I would assume you encourage individuals who have that gene from a parent, at least to stay on top of it, because to be you're a glaucoma, not a glaucoma patient as such, but on the watch list, so to speak.
Exactly. So we will call them glaucoma suspects. There's several risk factors. For example, African Americans are at higher risk, Hispanics, Indians, high pressure in the eye, if it runs in your family, even diabetes, nearsightedness, hypertension, those all can be risk factors.
This high pressure you referred to, you said hypertension. Is that a blood pressure thing you're talking
So
about?
hypertension is high blood pressure, but high eye pressure, ocular hypertension,
Are those different?
those are different, yeah.
How do you get high eye pressure?
Well, that's what glaucoma is. So we have to measure it. It's nothing you can see or feel. It's something only an ophthalmologist or optometrist can measure. If it's higher than, quote unquote normal, which is generally considered to be 20, then you could be at risk for developing glaucoma or ocular hypertension.
Tell us what you would do for someone who comes in to you and you initially diagnose them with a problem. Let's say it's glaucoma. What do you do for the patient? What do they do before you're a surgical candidate?
Yeah, so glaucoma is a common disease, and surgery is way down the line in treatment. It's very treatable. Recent studies have shown actually that laser should be the first treatment, selective laser trabeculoplasty. So the first thing is to explain the disease, what it is, what the problem is, and then how to resolve that problem. So if glaucoma is high pressure, then how can we get the pressure down? The first treatment is laser, and then there's several eye drops that work by putting drops directly into the eye that reduce the pressure. Lastly, if that doesn't work or if the stage is severe, certainly surgery is an option. Even cataract surgery actually can help reduce the pressure for glaucoma.
Earlier, you made a comment that you're, to Pat's question, that you're direct with your patients. So let's talk about something really serious. And you upon testing, you discovered that the individual has macular degeneration. How do you go about breaking that information to them and giving them the best hope possible?
Yeah, so macular degeneration, we have great treatments now. It's not, 20 years ago there were no treatments, so now macular degeneration, there's the dry kind and the wet kind, and most people fall within the dry kind of macular degeneration. That's, simply observing them every 3 to 6 months, depending on what kind they have.
Just so we're clear, what is it?
It's a disease that's age-related. It's a disease that affects the macula, that's the center part of the retina, where people can get fragile blood vessels that bleed, leading to central blindness. So versus glaucoma, where people can lose peripheral vision, and macular, you can use your central vision. But the dry kind is treated by ARIDs of vitamins that's high in antioxidants, wearing sunglasses, stop smoking, green leafy vegetables, and then monitor. Should something change, and it changes to the wet macular degeneration, that's what everybody's afraid of. Even that's treatable. There's very many injections called anti-VEGF that retina specialists will do, and we have some here in our practice, that are injected into the eye every 4 or 8 weeks, depending on the kind of medication and the kind of severity of the disease. So, these days it's treatable. It's important not to lose hope. It's not 20 years ago where we didn't have treatment. And there's always new research going on, and people don't like getting the injections. It's and a needle directly to your eye, every 4 to 6 weeks.
Yeah, I'm a hard pass on that.
But if it can get you driving again and it can
Sure.
prevent blindness,
Right.
yeah.
So let's talk a little bit about advances. Every day science is doing something different.
Right.
What's happening, perhaps not now, but what we see in the future in the next few years?
I mean, a lot of exciting things are happening. Ophthalmology is, a large field. I do glaucoma, cataracts. Cataracts, for example, you take the lens out of the eye, that's cataract surgery. And, 60, 70 years ago, there were either no lenses put in the eye or people started putting in very heavy lenses. People can remember their grandparents getting surgery, getting admitted, and having sandbags on both sides. And,
Yes.
and now it's 10, 15-minute surgery. Everybody gets an intraocular lens. The standard lens is covered by insurance that helps you see one distance, for example, far away. That's called monofocal. But lots of exciting new lenses are out, multifocal lenses that can help you see different distances. Lenses that we can adjust after the fact called light-assisted lenses. So, I mean, new advances all the time.
Could you give me like 10-10 vision with lenses so I could play baseball or anything?
Well, we can give you 20/20 vision
20/20.
if the rest of your anatomy of your eye allows it. So in other words, if every other structure is okay, you don't have diabetes, you don't have macular degeneration, you don't have glaucoma, trauma, injury, anything else. If we do cataract surgery, yes, you should get 20/20 vision.
Balance seeing patients on a daily basis with surgery. How many surgeries do you have in a given month?
Yeah, so
Yeah, on the average.
so that's a good question. Ophthalmology is a really good balance of procedures in the office, surgery in the operating room, and seeing patients. Tuesday's my surgery day, so I operate in the morning from about 7 to noon, about 12 cases.
12 cases in 5 hours.
And then in the office, I'm in the office Monday, Wednesday, and Thursday all day, seeing patients, doing lasers, minor procedures, and then Friday I go to Rush to teach.
Wow.
And then one Saturday a month, we all the doctors take turns working here in the office.
I understand also you volunteer your time with Tri-City Health.
Boy,
Well,
it's
so
near
you-
and dear to our heart.
Yes, so the way that works is...
You did a podcast.
We did a
Yeah.
podcast.
Yeah, I mean, we did this, started a long time ago. What we do is have their patients come to us because we have all the equipment here we need, all the tests we need, all the technicians. We just see them for no charge. So we want to be part of the community, and
It's,
patients in our community that need help, and if they need to be seen free, we take care of that. We also work with Lions Club and things like that to give back any way we can.
It's just an admirable thing, and I know when we did the podcast over there, they're always asking for, not only in ophthalmology obviously, but in
All fields,
lots
right.
of all fields, and asking for. I was stunned when we were talking, and they said, "Well, sure, we'll do acupuncture in here if we've got an acupuncturist." so the fact of the matter is, it's really a joy to people who really need such.
Right.
I know that a lot of what you're talking about here today is age related, right?
Right.
What can I do though, as a young person? I'm comparing myself. As a young person to avoid some of these problems, if anything at all. Sunglasses. What?
Exactly. Well, I mean, first of all, an annual eye exam, that's really important
That's
because a lot
neat.
of these diseases don't declare themselves in terms of symptoms
Right.
till it's almost too late.
Right.
So yes, if there's family history of macular degeneration or my mom had glaucoma, then you should say to yourself, okay, I'm no longer 40, maybe I'm 50, 55. Let me check in with an ophthalmologist or an optometrist, and you should have your pressure checked, vision checked, a good dilated exam. Other things, anything you're doing for your body, it's actually good for your eyes. No smoking, sunglasses, cardiovascular exercise.
Losing weight.
Losing
Perhaps.
weight, green leafy vegetables. But luckily, I don't tell people, I don't have to be that kind
Right,
of doctor to
right.
tell people to lose weight.
I
I just say
understand.
it's a good idea to eat healthy.
You brought something up also, if I may, Ray. I'm sorry. Optometrist, ophthalmologist. You said go to the eye doctor.
Yes.
Doesn't matter which one. I'm going to get the same tests either way, or
No, I would say, so the ophthalmologists are MDs. We went to medical school. I think we're trained to, treat diseases
Sure.
and to do surgery. So optometrists, a lot of them will give you a full eye exam, not just the glasses, but the pressure. But
Right.
it's important to have a dilated eye exam,
Right.
and not all optometrists
Right.
do that. And not all of them have the experience in the diagnosis, but what we find in the community is the optometrists here, if they notice a problem,
Right.
if there's something suspicious, optic nerve-wise, macula, cataracts, and then they will send you to an
Yeah, because I've had the full boat of tests at the optometrist. I've never been to see an ophthalmologist. Even when I got hit by that baseball, I thought that I should.
Yeah.
My parents didn't bother sending me to the doctor.
Yeah.
But yeah, I had a blood clot and I had to stay on the couch all summer.
Ooh,
Yeah, that's back when medicine was just,
yeah, you'll be fine.
you'll be fine.
I was going to say, speaking of that, before we go to break,
Sure.
one more question, and that is, if you had to highlight one or two massive advances from the time you got that degree, or degrees, to today, what would you say it is? As a learned ophthalmologist.
Massive advances in ophthalmology? Or
Yes,
in general?
in ophthalmology.
So one of the big ones in glaucoma, we call minimally invasive glaucoma surgery. So this was a big deal because years ago we did medicines and laser, then pretty big surgery that carried significant risks, trabeculectomy and tube shunt surgery. But then 14, 15 years ago, minimally invasive glaucoma surgery came out. There's many different kinds. And what that word implies is it's not as big of an incision, it's much faster recovery. And many times it can be done at the same time through the same incision as the glaucoma surgery. So that's been a deal, really big deal in the world of glaucoma, where you can do surgery and do it sooner instead of waiting till it's really late and doing a much bigger surgery that has a lot more
And again, I would
complications.
presume you've made advances in diagnostics.
Diagnostics as well. So when I started about 24 years ago, we came out with optical coherence tomography, and now it's everywhere. But back then it was still fairly new. I think I still remember we had somebody, we would rent it and somebody would do them once a month or once a week. But the idea is you can see all the layers of the retina and can diagnose macular degeneration, glaucoma at a much earlier state than we did, say, 30 years ago.
Take a quick pause for a small break. When we return, Dr. Hawkins to talk to us a bit about the Geneva Eye Clinic services here and the kinds of things that they provide here for all of their patients. We'll be right back. Hello, friends. This is Ray Rogina. Are you looking for the place to be? Voted best live music and entertainment venue by the Daily Herald in 2023? That would be Old Republic in Elgin, an indoor-outdoor hub with classic American eats, beer, and cocktails, plus the best sports bar, burgers, wings, and ribs. Best value? Old Republic. Another good place to be.
All right, we're back with Dr. Anjali Hawkins.
That's right.
And Doctor, now that we've talked a little bit about yourself and about eye disease generally, but now we want to talk about the Geneva Eye Clinic specifically. Where are we located?
So we're in Geneva, Illinois.
Oh, now, come on now. You can do better than that. Where exactly?
1000 Randall Road,
Okay.
Randall and Fargo.
Fargo, that's
Yeah,
correct.
So
yeah.
we were originally in the professional building of Del Nor Hospital. In about 2010, we saw this empty building. This was the old Kane County Chronicle.
Exactly,
Right.
the old
Building.
Chronicle.
You can still feel the vibe of the press.
So, you walk in and it had a very different layout. It had a press off to the one site, but, we hired an architect that looked at it and said, yeah, we can kind of make this work, and it's just been amazing ever since.
Well, give me the elevator version of what Geneva Eye Clinic and the services they provide is.
Well, we're a comprehensive eye care, so from anywhere from just a routine eye exam to anything in the front of the eye, cataracts, glaucoma. We have medical retina, so treatment for wet macular degeneration, dry macular, lasers for retinal tears, strabismus. We have a pediatric specialist, Dr. Brito, that specializes in double vision, pediatrics, strabismus. So really just about anything, and if it's not something we can treat here, we absolutely can diagnose it and then get you off to the right subspecialist as needed.
Do you do on-site surgical intervention, or is that
So
something?
the on-site, all their lasers are on-site for glaucoma and retina, as well as minor procedures like styes and chalazions, things like that. We also have an oculoplastics, a little surgery around the eyelids, but most of the surgery is done at either Valley Ambulatory Surgery Center in St. Charles or Delnor Hospital, a couple blocks away.
To say, as far as Pat was talking offline about insurance,
Uh-huh.
first of all, we've indicated
I'm a
that-
lawyer. See how that came up? Go ahead.
I usually like to not sit next to lawyers.
Oh,
but,
we're
you know.
fine.
Neither do I. Listen.
What is that?
With respect to insurance, though, first of all, you talk about the fact that you and some of your colleagues, maybe we ought to ask that question. Besides yourself, do other colleagues here make that contribution to Tri-City Health Partnership?
Everybody does.
That's
Yeah.
wonderful. So
Everybody does.
there's an avenue for those who are not insured and have issues with income and so on,
Yes.
and have eye problems. All right.
Yes.
Now, for a person who has a typical major medical policy and so on, I assume
Yes.
that makes it pretty simple for them to come in here, whether
Yeah.
it's an eye exam and or treatment. For
I think people
breast.
get confused. They kind of feel like they need eye insurance to see us, but we're medical doctors, so you just need a medical insurance.
Correct.
You know, Medicare is probably 50% of our business, if you will, but private insurance is Blue Cross Blue Shield, United, Aetna. We take all the routine things. Yeah.
Do you have a branch in here for eyewear?
Yeah, so we have an optical shop
Optical
upstairs.
shop.
Yeah, we also have an optometrist that fits contacts. So you can buy your glasses here.
It's a full-service operation, is what you're saying.
Yeah.
You probably have mirrors that people can look at themselves.
Yes.
Yes.
But they're all dilated, so they.
That's right.
Usually it's
Those are the clinicians, I take it? Or no?
the
Who are the
the
eyeglass
opticians. They're called opticians. Are the
Opticians.
ones that will help you fit glasses and buy the glasses.
Oh, very nice.
Yeah.
Very nice. Is there something that you guys do here that isn't done elsewhere necessarily? I know it's a kind of a competitive market, but
I think a lot of the other ophthalmology groups are doing similar things. We have recently adopted the new light-assisted lenses, so that's something new not everybody is doing, and we have the laser in-house.
plus you provide services with the smile and such. You
Yes.
can't get that as just everywhere, right?
Most professionals participate in what I would say is ongoing education.
Uh-huh.
And so the doctors here, yourself and others, I mean, you have a Ph.D. and of course a medical degree, but that doesn't mean you can't learn something. And so talk about that
Yeah.
process of a doctor, in this case an eye doctor,
Right.
moving along to new and
Right.
new
well,
frontiers.
Right, exactly. I mean, we all have to maintain our certification. So every year you get 25 credits, going to meetings or listening to podcasts or things like that. We also send our technicians to special courses. They have a certain number of trainings they have to get, or we will give lectures in-house for other staff. Two of us teach, Dr. Brito and myself teach at Rush. So we're constantly exposed to, grand rounds and unique cases, and teach the residents, do projects with students. So, I think we're uniquely in a unique position where we can learn there, bring things back to Geneva, and discuss with other partners as well and staff.
There might be a few individuals watching this podcast out there, and I don't know that our audience necessarily is loaded with high school and college kids, but for those out there that are, want to get into the medical field, and maybe more specific into this area, what's the outline for an undergraduate degree,
Yeah.
a preferred undergraduate degree, and then going from there?
Yeah, well, I don't think there's anything preferred. As I said, I did engineering. I have a partner that majored in music. So basically, you have to have an undergraduate degree, but at the same time, do prerequisites in sciences, the chemistry, physics, biology, then apply to medical school, which has become increasingly competitive. So either MD or DO school to get a medical degree, or you could go to optometry. That's different.
Right.
Then once in medical school, ophthalmology remains one of the most competitive fields. You make a big difference in people's lives. Your lifestyle is nice, so a lot of people want it.
Now, you had all your prerequisites in science, even though you were majored in engineering?
In chemical engineering, I did.
So you were planning ahead. You were being flexible.
Well, chemistry and biology, no, chemistry and physics and all of that was required for chemical engineering. The only thing I was missing was biology. But I had AP biology in high school.
Oh.
And so that last year, senior year, when I decided I was going to
I
apply.
forgot you're so young. AP. We had honors back in
Okay.
the day. Yeah.
So yeah, quickly caught up. And,
Yeah.
But it would be harder, to be fair, 30 years later. It's harder now
Sure.
than it was for me then.
As an educator, I hope you don't mind me asking this question. What did you write your dissertation to get your PhD?
The electrophysiology of the sodium-potassium pump.
Oh my God, I read that.
So it was done on frog eggs. So a
Sure, yeah.
frog egg itself was one cell, and then you put electrodes in it, and you studied the current depending on the different fluid around it, and made a mathematical model of how the sodium potassium
Well,
pump.
these frogs-
It's still in my living room.
Were they alive or deceased at this point?
Yeah, so they're alive, and we used to. It's going to probably not even allowed anymore. But you put them in a bucket of ice till they're kind of
No.
anesthetized.
Yeah.
You make a quick cut, take out a batch of the cells, sew it back up, and let it.
Seems like it was merciful.
I was going to say, in a fierce defense of the dissertation, I assume, in front of a
Yeah.
panel of individuals.
Right, that part's very scary when you're, proposing it and they break holes in it, and finally when you're defending it, it's very different than medical school. It's your own time. You wake up, you do what you want. Some days cells are cooperating, the experiments are working, and you stay all night. And other days you may not come in till noon.
Well, that's the genius of it, right? Yeah.
One final question before we really appreciate you taking on. We know you're a
Thank
busy
you.
woman
Thank
and taking the time to come in here today. But Geneva, another question about the eye clinic. You have two locations, one in Geneva, one in Elgin.
No.
Actually, we just have one location here.
Oh,
In Geneva.
Okay,
This
so
is-
that I missed on that. But
That's okay.
the second part of the question is still valid, and that is there plans for expansion of any kind?
Well, when we bought this in 2010, it was a much bigger space than we thought we needed.
Right.
So we were planning. I think right now we have 5 MDs and 1 optometrist, and we also have a part-time MD that comes for oculoplastics. So I think we still have room here. We just need to get staff, as you know, nurses and technicians and things are not easy to come by. But space-wise, I think we're pretty good here. We have
Well,
not
maybe the
made plans.
podcast could rent a room or something.
Fine by me.
Yeah.
It's fair to say that the Geneva Eye Clinic today, as opposed to the Geneva Eye Clinic that you walked into over 20 years ago, has evolved very nicely, in your professional opinion.
It's very nicely. It was a great place to begin with. It was, founded by leaders that I really respect, and that has carried down to how we take care of patients.
I just wanted to know, is eye care, is it a bigger problem now than it was 10, 20 years ago? I mean, are we seeing more and more patients?
I just think there's more and more patients. There's so many ophthalmologists. It's still really hard to get in.
So is it
any
because of
doctors.
something we're doing, we're not eating right, or we're letting our blood pressure get out of control? Or
I don't know. Maybe people are living longer as it is.
Living
and
longer.
Ophthalmology certainly is a field where most of our patients are older.
Right.
So it's not uncommon to see people in their 90s here.
Yeah.
Even over, we have patients that are over 100. So part of it's that. And
Well, that begs the question. One question that begs another question. That is, a lot of children come through here?
yes, because we have a pediatric specialist, and Illinois passed a law that you have to have an eye exam before going to kindergarten, which is wonderful because you can pick up a lot of things. So our optometrist, Dr. Angelo, and then our pediatric specialist.
So the
Dr.
government can do good things, is what you're saying. Just so we're clear, we have a website, GenevaEye.com. And you can get all of your answers to all of your questions,
Yes.
including your biography,
Yes.
online.
Listen, we can't thank you enough. As I said at the beginning, the treatment of eyes is crucial in your whole health repertoire.
Yes.
Of taking care of yourself. The eyes are very important. I think you've given our audience just a wonderful outline and some, the kinds of things that they need to be on top of to move along smoothly as they age.
I'm going to give you your advertising tagline. Ready?
Okay.
The eyes have it. All right? You can go ahead and use that for free.
The eyes have it
That's
at
right.
Geneva Eye Clinic.
It's the sauce.
Thank you, Dr.
Thank you so much for inviting me.
Nice
I really
to meet you.
appreciate it.
Dr. Anjali Hawkins of the Geneva Eye Clinic. We're going to take a small break, and Pat and I'll be back for some comments. You stay tuned. Hello, friends. This is Ray Rogina, and I want to introduce you to a great Fox Valley institution. Fox Valley Credit Union is a member-owned, nonprofit, cooperative financial institution dedicated to providing accessible and affordable financial services to the community with locations in Aurora and Oswego. Its services include savings, checking, debit cards, money market, IRAs, CDs, and more. It also offers mortgages, Visa credit cards, auto loans, and a variety of other financial services. For information on becoming a member, call Fox Valley Credit Union today at 630-859-2276 or visit them online at foxvalleycu.com.
All right, we are back. I put on my glasses as an homage to the wonderful Geneva Eye Clinic. Dr. Anjali Hawkins was fantastic.
Boy, she was. And you know, the fact of the matter is, what I appreciated about her professional life is the fact that she's not just a practicing doctor, she's a practicing teacher.
Right.
Of her discipline.
As we know, that's service to the community, right?
Yeah,
Regardless of whether you're being paid.
Right. And she's down there one day a week. So she has this Ph.D. and M.D.
Right.
And so we were in the presence of a very learned individual.
That's right. And if we ever needed a building built, no, she's a engineer. I don't know what type.
Well, I think for our audience, if you're, I'm talking to the audience here clearly now, and if you were watching her, she covered a lot of bases that you need to consider, particularly if you're a little bit more negligent about your treatment of your eyes. And, you know,
well, a guy like myself, I didn't even know that I should see an ophthalmologist as opposed to.
Oh, you know, not to get personal, I just think that it's a good advice.
Well, I failed
advice.
my eye test at the driver's.
You did?
Yes.
Oh, that's all the more reason. There's a reason why you failed it.
Well, they said you have to go now to go see a doctor. You have to get certified. So I had to do that and come back.
All right. Well, then you did go see an ophthalmologist.
No, an optometrist.
The optometrist wasn't necessarily a doctor, though, as she indicated.
Well, she was able to sign the paperwork.
I know.
Yeah.
But I'm just saying, don't shirk that responsibility.
No, but we did all the tests. We did the thing.
I like your candor, the fact that you're admitting to that. I'm just saying.
Oh, yeah.
I think you should see an ophthalmologist.
But I do have
You are getting older.
2 pairs of glasses, just in case. But now, yeah, I do have driving glasses because of that entire experience.
To me, there's a few diseases in life that are horrific.
Yes.
And one of them is blindness.
Well, that's a question.
One of them is blindness. That to me is one of the most horrific things that could happen.
That's a question I would have for you. Would you rather be blind or deaf?
Deaf. No, I have hearing aids.
Really?
I would rather have be deaf than blind.
I would
The
rather.
loss of sight to me is monumental in anybody's life. But now those individuals who are born blind, they get
That's a
through
different
it.
situation.
That's a whole different
because
situation.
they haven't seen anything. So I would say I've seen it, but I want to be able to listen to music, conversation.
Well, you know, but I answered the question. I just think that she's provided, I think, a very good outline of what you need to think about. I'm so happy that finally, after 3.5 years, we got a doctor on here specifically in the area of eye care.
That's right. Very important. I know that I'm going to make an appointment.
Good.
And I
Glad to
like
hear
the
that.
fact that she serves the community. That
was the other. That's the little frosting on the cake today. That she piggybacked off that by saying Geneva Eye Clinic, all of their people here contribute to Tri-City
Tri-City Health
Partnership, Tri-City Health Partnership, and so I'm so happy to hear that. Anyway,
so fantastic interview, and I'm glad we did it. And Geneva Eye Clinic. Let's go with the website again, GenevaEye.com. All your questions will be answered there.
and an appointment if you need to. And one more point, very important here: you do have major medical insurance. Don't have this myth that it's not covered. Or if you're getting up there in age and you have Medicare, get in here. I know my field test every year is paid for.
Yeah.
Because of again, it's a medical issue because my dad had glaucoma, so I'm
Future podcast, perhaps Medicare questions regarding it.
we have to get an authority on this subject, and then,
Right.
but that's absolutely a good possibility.
Well, for our crack producer, publisher, owner.
No, he's not the publisher of Fox Valley Magazine. Remember, the man in blue here is
No,
our
I know.
publisher.
I was calling Paul crack. You said I could do
but
whatever I want.
you call him the publisher. He's not the publisher.
Well, it's
Kevin-
been so long since I've seen him. I can't remember what
I
it
would
is.
agree with that. I think we
might
do
be the
need,
cartoonist,
right? There actually are some people that I know that are making predictions about whether we'll ever see him again.
Oh my!
And
As long as the check comes, right? That's the
well,
important.
I think we
You'd
need-
rather like to see Paul though.
I
You guys have a lot in
I-
common. U of I.
Well, I didn't go to U of I, but they
whiskey.
won a big football game this
Yeah.
past weekend.
Yeah.
That's for darn sure. Anyway, congratulations, Paul. Go ahead. You can continue along with your closing.
For our videographer,
And crafty.
crafty,
He is crafty.
and when
He
and
went,
how.
went out communication.
Yes.
But you notice how he moved this thing around very carefully today because we're in a kind of in a tight space here.
Right. He's flexible with the spacing. You want that in a videographer.
I would.
Plus, this is his second show today.
I'm ready to. I gotta play cards tonight though. So I gotta. It's been a long day and it'll be longer.
Rumor has it there's a ball game on as well.
I don't pay attention to
I
that.
understand. I understand. I know you're a baseball fan though.
I will pay attention to it. Actually, I'm in a pool with two other individuals, and I've made some selections. So yeah, I have a distinct interest.
FanDuel.com.
No,
It's
a
not a
couple-
sponsor.
A couple friends.
Oh,
All right. So anyway, so we thank Kevin. We
Right.
thank Paul.
Ray, thank you very much for being here today.
Pat, thank you very much for being here.
And
today.
for Ray Rogina, this is Pat Kremens saying, so long. Ray, Pat,
Pat and Ray,
Ray and Pat,
just a couple of guys.
thanks for watching.
So long, everyone.